Hi everybody, so this is a very important video where we're going to be discussing what to do if a contraception is missed. And this has been, if you see the previous year papers, this is one question where questions keep coming from. So let's start with missing a combined oral contraceptive pill. So if one or two pills are missed, okay, and this is from the Government of India Ministry of Health and Family Welfare guidelines, which I'm telling you this from. So if one or two pills are missed, or if the packet is started 1 or 2 days late, then the contraceptive efficacy is not hampered. Nothing extra needs to be done except that she should take the last missed pill as soon as she remembers. But if she has missed 3 or more pills, okay, and in the first 2 weeks, what should she do? She should take the last missed pill as soon as she remembers. She should use an additional backup contraception for 7 days, and if she's had intercourse in the last 72 hours, she should take an emergency contraceptive pill in addition. Also remember that if she has missed 3 or more pills in the third week of the 21-day packet, that means the last 7 days, then what should she do? She should take the last missed pill as soon as she remembers, use additional contraception for 7 days, take an emergency contraceptive pill if she's had intercourse in the last 72 hours, and in addition, very importantly, start a new packet immediately without giving a 7-day break period. So now the next pill important to remember is the progesterone only pill or the mini pill. Now remember with the mini pill, it's very important to take it at the same time every day. Okay, because if she misses the pill and the gap is more than 3 hours, then it can affect contraceptive efficacy. What does the Ministry of Health and Family Welfare say? That if she's missed the pill more than 3 hours, she should immediately take the missed pill. That's all that it says about the progesterone only pill. The next important contraception is Centroman. Now Centroman, we all know, is taken twice a week for the first 3 months and then weekly for the next, till whenever she wants contraception. So if the pill is missed, she remembers it more than 1 or 2 days late, but within 1 week, okay, then she should take the pill as soon as she remembers and use additional contraception for 7 days. But if she forgets the pill and it's been more than a week, then she has to start all over again. That is twice a week for 3 months and then weekly thereafter. So that's about missing Centroman. So the next type of contraceptive forgotten to use or to take is the vaginal ring. Now the vaginal ring is not commonly used in India, so there are no Indian Government of India guidelines on missing or forgetting to take off the ring. So but what you should remember is that the ring is worn for 3 weeks, okay, and then a 1 week gap is given. Okay, so what is important to remember is if the woman forgets to take off the ring, what should she do? So if she forgets in week 4, okay, so she's worn it for 3 weeks and she forgets and she remembers in week 4, what should she do? She should remove the ring after week 4 is over, take a 1 week gap and use additional contraception for 7 days and then start a new ring after the 1 week gap. But if she forgets up till 5 weeks, then contraceptive efficacy is definitely hampered and she could be pregnant. So the next type of contraceptive is the transdermal patch. Now again, it's not something commonly used in India, so no Government of India guidelines available on this. But what should you remember? First of all, you should know how the patch is used. It's used weekly. So every week a new patch is applied for 3 weeks and then a 1 week gap. So 1 week, 1 week, 1 week and then a 1 week gap. Now what is important, or what a potential question can come, is if the patch detaches, okay, and she notices it within 24 hours of it being detached partially or completely, she should just try to reapply it, and if it's not possible, if the adhesive has gone off, then apply a new one and continue the same way. But if the patch has been detached partially or completely for more than 24 hours, then contraceptive efficacy is hampered and she has to start a new cycle. So start a new patch and then again 1 week, 1 week, 1 week and then 1 week break. And she has to use a backup method for the first week of that new cycle. And the last one is Antara, that is depomedroxyprogesterone acetate. What is again important to remember is that this is a 3-monthly intramuscular injection. So what should you do if the woman comes either early or late? So if she comes 2 weeks earlier for the injection or up till 4 weeks later, that means a month later, nothing to worry, give her the injection and just tell her to come on time next time, okay. But if she comes more than 1 month later, that means 4 months or beyond, okay, then what should you do? Then contraceptive efficacy is definitely hampered. You have to give her the injection, of course, and advise her a backup contraception for 7 days and remind her to come on time the next time.